When we think about old age, we often picture peace and tranquility. The years filled with memories, calmness, and freedom from the stresses of daily life. We imagine time spent with loved ones, rediscovering forgotten hobbies, or simply relaxing in the living room, sipping warm tea and reflecting. But for some, old age is not a time of peace. For them, it's a time when anxious thoughts and uncontrollable fears start to take over their everyday lives. They feel trapped in repetitive routines, checking every door, turning lights on and off multiple times, or spending hours just to ensure that something that doesn't really need attention is being checked. And while we often hear about this disorder in younger people, the truth is that obsessive-compulsive disorder, OCD, can also affect the elderly. This mental illness knows no age. Even in the twilight years, we can still be caught in a cycle of anxiety that makes life feel uncontrollable. In a small house on the outskirts of Boston, Robert, a 76-year-old man, begins his days with a routine that seems normal at first glance. However, for Robert, this routine is more than just a habit. Every morning, Robert wakes up around 5 a.m., not because of an alarm, but because of an urge to check the stove. He feels compelled to make sure the stove is turned off, and he does this repeatedly 5 times, sometimes more, before he feels at ease. This routine drains both his energy and time. He knows there's no real reason to keep checking the stove, but the anxiety in his mind just won't let him move on. After checking the stove, Robert heads to the bathroom where he spends more than 15 minutes washing his hands, repeatedly, until he feels clean and safe. Then, he moves on to checking the doors and windows around the house, repeating the same actions over and over again. Each time he feels like something's not right, he has to go back and check, and if he doesn't, overwhelming anxiety takes over. Robert knows it's all irrational, but there's no way he can find peace without doing it. On the other side of the world, in the UK, there's Jane, an 81-year-old grandmother who has long since retired. Jane is a warm and caring woman, always offering a smile to everyone she meets. However, behind that smile, Jane harbors a habit that disrupts her life. Every time she folds clothes, she feels she must do it in a very specific way, perfectly aligned, with no gaps. She will fold the clothes repeatedly, rearranging the pile, until she feels satisfied. If not, she feels anxious and worried that something bad will happen. She knows it's all an irrational habit, but she can't stop herself. Jane struggles to explain to her children why she does this. They often dismiss it as just a quirky habit and don't understand that the anxiety she feels goes much deeper than they can see. Sometimes Jane feels isolated, as though no one understands the burden she carries. Even when she tries to explain, she is often told, "Oh, it's just something you do," but it's so much more than that. It's her way of coping with the intense anxiety that threatens to consume her every day. What is OCD in the elderly? Obsessive-compulsive disorder is an anxiety disorder that leads to repetitive behaviors meant to reduce the anxiety caused by obsessive thoughts. Typically, this disorder is seen in individuals who are excessively worried about small things, and to relieve that anxiety, they feel the need to perform certain rituals, such as checking doors repeatedly, washing hands excessively, or arranging objects in a very specific way. However, when OCD occurs in the elderly, it can manifest in very different ways. Some elderly individuals experience OCD that they never had in their younger years. They may not have been anxious about such things before, but in old age, they begin to feel trapped in repetitive rituals. This isn't just a quirky habit, it's a mental disorder that affects their daily lives. And the intensity of this disorder is often heightened due to the physical and emotional challenges that accompany aging. Symptoms of OCD in the elderly can vary widely. They may feel the need to check household appliances like the stove, doors, or windows repeatedly because they fear something bad will happen if they don't. Or they may feel compelled to perform certain rituals like washing hands, turning lights on and off, or even avoiding certain places due to fear of contamination. These are not choices. They are powerful urges they can't control. What's even more concerning is that OCD symptoms are often mistaken for normal aging. Many people assume that the elderly become more fussy or particular as they grow older, when in fact, they may be struggling with a mental illness that can be treated. Many elderly individuals with OCD may feel embarrassed or ashamed of their behavior, which is why they often keep their struggles to themselves. They may avoid talking to family members or friends about it, as they feel embarrassed that they might be labeled as crazy or too old to have these kinds of issues. It's essential for family members to be open-minded and understanding, offering support and encouragement when they seek help. Why does OCD develop or worsen in the elderly? There are various reasons why OCD may develop or worsen in old age. One significant factor is emotional stress brought on by major life changes. The loss of a spouse, retirement, or changes in daily routines can be major triggers. In old age, many elderly individuals feel a sense of loss of purpose or control over their lives. This loss can trigger intense anxiety, which then translates into obsessions and compulsions. The death of a loved one, for example, is a profoundly stressful experience that can cause overwhelming feelings of sadness, grief, and loneliness. In many cases, this emotional stress leads to the development or worsening of OCD symptoms. The individual feels like they have lost control over their life, and their obsessive-compulsive behaviors are their way of regaining a sense of order and stability. Additionally, natural changes in the brain play a role. Our brains undergo changes as we age, and some areas of the brain that regulate impulses and anxiety, such as the orbitofrontal cortex and basal ganglia, may not function as they should. This can lead to someone feeling compelled to perform rituals in order to reduce anxiety. There are also other medical conditions to consider, such as mild strokes, early-onset dementia, or side effects from medications they are taking. Medications used to treat heart issues or blood pressure, for example, can sometimes affect mental function and exacerbate OCD symptoms. These underlying conditions can make it even more difficult for elderly individuals to manage their OCD symptoms. Equally important is the sense of loss of control. As people age, they may feel that they no longer have control over many aspects of their lives. This can trigger anxiety, which eventually gets translated into obsessive and compulsive behaviors as a way to regain some sense of control. For example, a person may obsess over cleaning the house repeatedly because they feel that cleaning is the only thing they can control in an otherwise unpredictable world. Can OCD in the elderly be treated? The good news is that, while OCD is a complex disorder, it can be treated, even in old age. The most effective treatment methods for OCD in the elderly are cognitive behavioral therapy, CBT, especially a type called exposure and response prevention, ERP. This therapy helps individuals gradually face their anxieties in a controlled way until they can reduce their compulsive behaviors. However, it's important to note that this approach needs to be done very carefully and with great empathy. Therapy for the elderly is usually slower and more structured. Additionally, it's crucial for a therapist to understand that elderly people have very different life experiences, and this affects the way they deal with anxiety and fear. They may not respond to therapy in the same way that younger individuals do, so therapists need to be adaptable and patient in their approach. Furthermore, mindfulness and spiritual approaches have also proven effective. Elderly individuals with OCD often find great benefit in activities that help them stay focused in the present moment, such as meditation or prayer. These activities can help individuals regain a sense of inner peace, allowing them to focus on the present and release obsessive thoughts. Medications such as selective serotonin reuptake inhibitors, SSRIs, have also been found to be helpful in treating OCD. However, medications should only be prescribed by a doctor after a careful evaluation, as some medications may have side effects that are particularly concerning for elderly individuals. The role of family in supporting recovery. OCD is not something to be faced alone. It's a disorder that affects an individual's entire life, including their family and loved ones. Therefore, the role of the family is crucial in supporting an elderly loved one struggling with OCD. Listening with empathy without judgment is key. Sometimes, family members feel frustrated or confused, and they may not understand why their elderly loved one does certain things that seem illogical. But reminding them that this is a real mental disorder and that they need support is the first important step. Family members can play an essential role by helping the individual with therapy exercises at home, encouraging them to stick to their treatment plan, and helping them stay calm when they feel anxious. It's also vital for families to educate themselves about OCD and learn how to approach it in a compassionate and understanding way. If someone we love is experiencing OCD, it's important to help them seek the right medical care, such as encouraging them to go to therapy and accompanying them through every step of the healing process. With patience, support, and understanding, we can help them reduce their OCD symptoms and improve their quality of life. OCD can affect anyone at any age. But as we know, there is no age too old to find peace. Everyone, no matter how old they are, deserves the chance to live free from the fears that bind them. For those who are struggling, remember that hope is always there, and the journey to find peace, though difficult, is a journey worth taking. With proper care, compassion, and treatment, those who suffer from OCD can lead fulfilling lives, free from the constant anxiety that plagues them. There's always a way forward. Always. Disclaimer: calming music playing. This video is intended for educational purposes and raising awareness about OCD in the elderly. This information is not meant as a substitute for professional medical diagnosis. If you or someone close to you shows signs of OCD, we highly recommend consulting with a mental health professional.